My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Today on the podcast, we have Clarissa Carlson. Clarissa is a music therapist out of Washington, D.C. She provides music therapy for cancer patients, kids with sickle cell anemia, and has also done work with trauma and psychiatric hospitals. She has also worked with a good friend of mine, Ryan Gebler, who lost his fight to cancer in 2012. And the therapy Clarissa provided for him goes beyond words, and I know all his family and friends are beyond grateful for the wonderful musical outlets she provided for Ryan in his fight with cancer. This episode is dedicated to Ryan Gebler and the Never Retreat Foundation. Please welcome Clarissa Carlson. So, Clarissa, where are you from?
Right now, I am living in Washington, D.C. I was born in Canada, and I have traveled up and down the East Coast for most of my adult life. And my parents emigrated from the Philippines.
Okay. Wow, okay.
To cover all the bases.
Yeah, you did. What part of Canada did you grow up in?
So I was born in St. John's, Newfoundland, like right on the wharf. Lots of lobsters. I hear you could get a box lunch of 2 lobsters for $5. Which is crazy, right? Yeah.
That is crazy, yeah.
I was too young to remember.
Yeah. It must have been freezing up there, too.
Oh, yeah. It's pretty cold. I think I recently read something about they can see icebergs off the coast of where I used to live right now.
Wow. That's intense.
Yeah, it really is. We also lived in Halifax, Nova Scotia, and then in Winnipeg.
And so did you grow up in your teenage years up there as well?
No, I moved to Florida when I was 11.
Polar opposite world.
I like to think that my parents got tired of the cold.
Wow, where in Florida did you grow up?
So that was St. Petersburg, Florida, right on the west coast.
Oh,
yeah.
Beautiful. Yeah, and what were you into as a teenager?
You know, I have always been into music. I've always been into classical music.
Makes sense.
I don't know why or how I even knew what they were, but I told my parents when I was 3, I wanted to play either the cello or the harp.
Really? 2 very unconventional instruments.
Yeah.
Someone growing up today, yeah.
And inconvenient, too. They're both very large.
So did you get good at playing the harp and you said it was the cello?
The cello, yeah.
Yeah.
So I went with a smaller of 2. So
Really?
I played the cello,
Yeah.
and I've been playing the cello since I was 8. So I have to do the math. It's 27 years. Yeah.
That's amazing.
Yeah.
That's amazing. So you have one of the most noble and amazing professions I have ever heard of, and you provide an outlet to so many people, and not only those people that you're helping, but to their families who are also going through all those tough times. So can you just elaborate on a little bit on what you do, how you got into that, and how you even found that niche of a field, because that is just amazing to me.
Oh, well, sure. It is a small field. I think that there's something like 7,000 music therapists in the States. Pretty small. Comparatively. Like I said, I've always loved classical music, and the reason I loved it was because it had this capacity to hold conflicting feelings and emotions in its expression at the same time. Yeah, and I think that is what lots of people love about whatever music it is that they like. That capacity to express poignancy. And so I was a professional musician, and I went to conservatory. I freelanced as a cellist for a while.
Wow, I didn't know that.
Yeah.
That's amazing. That's impressive.
Thanks. I think that being a professional musician is a lot less romantic than what it sounds like.
Right.
I'm sure you probably know what that's like.
I'm still aspiring to be a professional musician
Oh,
myself.
really?
No, kind of joking, but kind of not. Like, I'm awful. But I play the harmonica, and
you do?
Hopefully one day it'll take me somewhere. Oh, yeah.
Oh, my gosh. That's fantastic. You know, we're going to have to talk about harmonica because I'm doing a study with a harmonica in the hospital.
I'm your study. Let's do it.
That's fantastic. Wow. So when I started feeling like, all right, I don't think I can do this professional musician thing for the rest of my life in my mid-20s, I started shadowing. I really realized that I missed people because to be a professional musician in the classical world, you do have to spend a lot of time, practicing and put in a lot of hours going to rehearsals and concerts and playing weddings because that's how you pay your rent and all that kind of stuff.
Definitely, yeah.
Yeah. And I felt like, I'm playing for people, but I'm not really playing with people.
Yeah.
Yeah. And so I started shadowing a music therapist. I cannot really remember where I heard about music therapy, but
Really?
I did hear about it at some point somewhere.
And what area of the country were you in when you heard about it?
That was Baltimore.
Baltimore.
Yeah.
Okay. So what was your first experience like? First time you shadowed a music therapist, what was your experience?
Oh, it was pretty great. She worked with adults with developmental delays, and it was an evening group program, like an hour and a half. And it was really amazing to see how she made the music making very approachable and inclusive, helping the participants in the group to play the instruments, to feel like they're part of the music making. And we were doing popular songs and stuff.
And what was the group that she was working with?
So adults with all kinds of developmental disabilities. I don't remember. I think it's like a day program.
Gotcha.
Yeah,
Okay.
at a center. And it was, probably about 10 adults. And they kind of went through a bunch of their favorite songs and singing and playing instruments along with it and that kind of a thing. And then I also shadowed a music therapist at Kennedy Krieger Institute, the rehab hospital. So they were working with kids mostly on things like, the self-expression type stuff. There was a little bit of music therapy, co-treatment with physical and occupational therapy, but I didn't get to see that when I was there.
You didn't dive into that. Okay.
Yeah.
And then how did you meet Ryan Gebler?
Okay. Ryan.
Because knowing Ryan Gebler, you probably just fulfilled his life like beyond words, because the amount of struggle he was going through and the amount of how much he loved music, that outlet that you provided him must have just been one of the best. It's one of the best combinations I could think of in a person that loves music and it's fighting a battle of cancer that's very hard. Especially for someone that loved music as much as him. I can't imagine what you were able to do for him. And I'm sure I know his family speaks very highly of you, because I heard you talk at his foundation and it blew me away. So how did you get into that niche where you started working with Cancer Unit and all that?
So let me start just talking about Ryan. I can't even begin to express how much of an inspiration Ryan was to me at the time that I met him, because I had just started working at Children's National a few months before I met Ryan. He came with this vivacity and this zest for life, and everything to him was, whether it was challenging or he always had a smile on his face and he was ready to meet anything,
Oh, absolutely.
Yeah. Honestly, he was a consummate musician in his own right before I ever stepped into the picture. I feel like he taught me.
Yeah, he was always playing shows and everything. Yeah.
Yeah, I feel like
he loved it.
Yeah, I feel like he taught me more than I could have ever taught him. And again, it's not about teaching. So Ryan came to Children's because he was diagnosed with cancer that, although he was an adult, it's considered a pediatric cancer for medical reasons that I don't know.
Right.
So what we were working on with him, because he was such a great musician in his own right, I really wanted him to not lose touch with that. Right. What we see in the hospital and with illness in general is that your whole sense of self reshapes itself or has to integrate the illness into, This is part of your self-concept now. Who are you?
Absolutely. I'm sure a lot of people struggle with that, and they feel like their disease becomes them and they get trapped inside of a world that they might not have a lot of outlets.
Right.
So for you to provide that for them. So the music's one thing, and do you have to provide them almost the therapy of you are not your illness?
Oh yeah, that's an integral part. And my background, my master's degree was in music therapy and counseling, so I'm very much steeped in that approach of really trying to support the sense of self within illness and within wellness. Because music was such, and musicking or making music was such a big part of his identity, it was apparent to me immediately that what he got the most out of was making music. I didn't really feel like he needed to talk through a bunch of stuff with me. Also, because we have a very robust psychosocial team and he was seeing my good friend and colleague psychologist at the same time. So I knew he had that verbal outlet with a licensed psychologist. So
when he sat down with you, was it like, all right, we're making songs today, we're making music? You provided him with that outlet as well?
Yeah.
That is amazing. Okay.
I think that was the bulk of what we did, honestly. And at the beginning, he brought his guitar. He wanted to learn Paco Bell's canon, and we would improvise on things like that. And he wrote his own stuff. I would bring my cello because honestly, I wasn't nearly as good a guitarist as Ryan was. So I felt like I needed to bring my main instrument to meet him where he was.
Absolutely, yeah.
So
did you do it in the hospital room, or do you bring the patients into another wing of the hospital where it's all music, or it's just right bedside?
Right at bedside. Yep. Right at the bedside. Because, those patients can't move too far. And also I didn't have another space. So,
right.
So right at the bedside, the work really changed over time. You know, as he became more ill, as he relapsed and things got a little bleaker, he wanted to listen to music more. He wanted to share music that he had recently heard, recently discovered with me more and just talk about that. And I remember this one time I played Hallelujah for him. Just guitar singing.
Yeah.
And he just wanted to hear it, like, for weeks. Yeah. For weeks on end, that was the only thing he wanted to hear.
That's a very powerful song.
Yeah. And I knew that this song means something to him. While I allowed the silence for him to talk about it, he never did. And I don't think he needed to. I think it was all there in the experience of the music, whatever he was going through.
He just wanted to hear it.
Yeah.
He just wanted to hear it.
He just wanted to hear
amazing.
it.
Yeah.
Yeah. And whatever he was going through internally, he was going through, and he didn't need to talk about it with me.
That's incredible.
Yeah.
So I guess every single appointment that you have with your clients is different depending on what their needs are.
Yes, that is true.
And so it's different on every client, and every client might play a different. What if people don't play an instrument? So I'm just curious how you get assigned to patients, even if they're not musically inclined. Like Ryan was obviously very gifted at it. What if someone just like wants just to try it out?
Yeah, so I would say the vast majority of my patients don't have any musical training at all, you know?
Wow. Okay.
So really the bulk of my work as a music therapist is bringing them to the music, making the music more accessible to them so that they can participate in it. So I've worked with patients like who have young children, right? Like, you know,
mm-hmm. Yeah.
And it at Children's, but also other places. And I might do like some mommy and me type stuff, like showing them ways of engaging with their baby musically. And in that context, it's not so much about the music as it is about mom or dad and infant interaction. And my goal with that would be to A, support the baby's development, and B, provide some sort of shared experience for bonding and just enjoyment of one another within that parent-child relationship. Yeah, my goals, they can be informed by lots of different things. I tend to take a very developmental perspective, like this is what one needs for optimal development, and here's how music can support that.
I love that. I think that's huge because music has the ability to change whatever mindset you're in. It has the ability to bring you back to a certain moment in your life. It can literally take you anywhere, and it can be extremely healing, and it might even be more effective than medicine.
In some cases. Sure, yeah.
Do you know what I'm saying? Because I don't even think we even realize how powerful our minds can be. I mean, they've done studies where they've given people placebo drugs, and they told them that it was the real thing, and just the power of the mind, thinking those people were actually taking those drugs.
Right.
Some of their illnesses went away just from mind power. So you are bringing in a completely different element to the healing process. Who knows how powerful it actually is, because you can be having as great an effect as all the medication and all the other healing aspects are, just from sitting with these people and giving them the gift of music. I think that's incredible.
Thank you. Wow, that's incredibly complimentary. I can't say that it's me, though. I mean, like, you know, there are very, very many fantastic thinkers and professors and teachers and therapists. Really, I mean, music has been used in medicine since like the 1800s, really.
Wow.
Yeah. And then if you want to go all the way back to David and his harp and whatever, you know, all that kind of stuff.
Can you provide any like examples of like what they were doing back then?
Yeah, so in the late 1800s, there was, I think his name is Ira Altschuler. He was a psychiatrist who started providing music for recreation and education on psychiatric wards. And he saw it as kind of a rehabilitative therapy. So that was one way. And that was way back when psych institutes looked nothing like they do now. And then fast forward to after World War II, you had volunteer musicians going into these hospitals and to veterans centers, which we're kind of seeing a resurgence of that now in a different format. And they would play these music for these veterans without really being prepared for it, elicit some very, very intense emotional responses.
Oh, yeah, definitely.
Yeah. And so back in the late 40s, the 50s, musicians started to realize if we're going to provide this and it's going to be helpful, we kind of need to know what we're walking into. Mm-hmm. And so that is when the modern profession of music therapy started in the United States. Yeah, I think the first training program was developed in like 1945 up in Michigan. And then, you know, right now, today we have something like 80 undergraduate music therapy programs. And then there's a number of master's programs and a couple of PhD programs.
It came into around the 40s and 50s. The musicians actually wanted to study what was going on and the actual effect it was having.
Right. And I mean, it's so hard to quantify and to really really say what the effect is, right? So if you look back at the development of music therapy through the 70s and 80s and 90s, it kind of tracked with what was really not popular, but what was central in psychology. So you had music therapy that was more behaviorally oriented, at the same time as behavior therapy was a huge thing in psychology. And then you had the reaction to that, which was music therapy that was more psychoanalytically driven when that was the thing. Mm-hmm. And now I think we're starting to really understand that there are so many different ways of practicing music therapy and so many different client needs and contexts. Yeah. So there's no one approach. Music therapy is transdisciplinary. It has so many different homes depending on the context.
I love how it can be physical, like if someone just needs to have an actual outlet of playing the instrument, and it can also be internal of the music coming outside in and taking care of the patient that way. And I feel like everybody these days wants to quantify everything scientifically of how is this exactly affecting that person or patient. And sometimes, it's so hard to quantify because you can't measure that person's reaction. Like how you were saying with Ryan, like you can't get inside that person's head and know what they're feeling and the actual release in that.
Yeah, I think you're absolutely right. And I think one of the things that's really central to all creative arts therapies, not just music therapy, is that art, sound, vision, all these senses are pre-verbal. So we understand the world in images and in sounds and in movement before we can language it, before we can talk about it. And so music and art and dance and all these artistic modalities, all these aesthetic modalities are ways of expressing a psychic truth, a reality. I just read about this yesterday, by the way, so this is kind of why. Really? So this is all fresh in my mind.
That's very interesting.
Yeah. But yeah, I mean, if you look at art as a way of expressing a psychic reality, everybody's reality is going to be different. And that person might not even know what their truth is, what their inner experience really is before expressing it. And that is one of the principles that underlies therapy, too. It's like, if you can talk about it, then you can understand it.
Right.
Sometimes you can't talk about it, but you can express it in music, or you can express it in art or in movement. Through that, you might be able to get to a more verbal, cognitive understanding of whatever it is. And trauma is a huge arena where this is practiced because the way that, and I don't know all the neuroscience behind it, but the way that memories are stored when one has a traumatic experience, it's disintegrated. So part of that integration is responding to it in all these visceral ways before one can really understand what just happened.
Right. And so music can be extremely visceral, like and you can feel it and everything. And so for traumas, do you think it could almost unlock some of those past emotional traumas and help get that out?
Yes, I do. I know music therapists who work almost exclusively with trauma. I am not one of them. But I think that those music therapists would say that yes, music can approach what is that traumatic material and approach starting to make sense of it. But you have to be really aware as a therapist, like what are you eliciting and how will you contain it? Because there's only so much you can open up in a single session and work through before you have to close that person up and send them back out into the world to function again. So it's not just let's immerse ourselves in this music that will flood your senses with the memories and all that kind of stuff. But although while that could happen, it's not necessarily helpful. So a music therapist working with trauma might choose music that addresses one particular aspect, say, of whatever that trauma was.
And a person that has been through a ton of trauma might not be all that verbal. So when you give them an instrument and they can express themselves in that manner, you're opening pathways and gates that you wouldn't be able to do with just by talking. So, right?
Sure. I think you're right. So I'll talk about a case that I worked with when I was working in a psychiatric hospital. There was a teenage girl who had experienced some kind of trauma, and every time she wanted to talk about it, she couldn't. Like her voice would just kind of close up, her throat would close up. And so I happened to have her in an individual session, and we worked with drums. And just really just a really basic rhythm, not just a beat, like 1, 2, 3, 4, but just something very simple on the drums. And we would breathe to it. And then we would start toning to it and just start getting that voice moving again through it with the drums underneath it. Over time, we started to really work with just using her voice more loudly and then starting to talk about what was going on, what the trauma was with her. And then at that point, I went to my team and I said, all right, so here's where we are and this is where I need everybody else's expertise to start working through the material of this trauma. But we started with unlocking the voice.
So with the drums and the breathing, were you unable to lock that voice with that? Was she verbally talking to you about that?
Oh, yeah. No, she was talking. Yeah, she was like, you would see her in a middle school and think, nothing.
Right. But when it came to the traumas and you started playing the drums, while she was playing the drums, was she unable to unlock that voice? Or then she finished with you and then she went to the...
Oh, no.
Unlock it
So I'm talking about the physical mechanism of vocal sound production.
Right.
And so, we kind of practice by yawning, yawning with sound. And because that is not threatening, right? That's not nearly as threatening as talking about emotionally charged material. So we did a lot of things with vocal exercises, warm-ups, things you would do as a singer or just for fun, whatever, just to get her voice. The fact that she was there in a therapy session on an inpatient psychiatric ward, that trauma was close by. I didn't need to talk about it for her to think about it.
Right.
So just being able to use her voice in this context and then use it to talk about what she was feeling in the moment and then use it to talk about what she had been feeling or what she went through before. It's kind of like a ladder.
Yeah. So is your niche with music therapy, is it strictly right now with people diagnosed with cancer, or is that primarily what you're working with right now?
My job was, and I actually recently left it, and I'll tell you why in a minute. No. It's good. I got into school. I'm going to a PhD program. I worked in the Center for Cancer and Blood Disorders, so it would be kids who have cancer. It would also be kids who had blood disorders like sickle cell disease. And with sickle cell disease, we're working a lot on many, many different things. That the hallmark of sickle cell disease is pain. And there are a lot of patients who had chronic pain and all of the psychosocial sequelae that come with that. So when the kids who had sickle cell disease are inpatient, I might work with them on just relaxation skills, again, with the breathing and learning autogenic relaxation, imagery exercises, learning how to think their way through the body and breathe through the body.
That's amazing, yeah.
Yeah, to help them manage pain. And the sickle cell practitioners were very, very keen on anything non-pharmacological that we could do for these patients because they're going to be living with pain their whole life.
So that was one niche you had. Mm-hmm. And so recently just left?
Yes. Yeah.
You're back in school now?
I will be starting school in September. It's a PhD in creative arts therapy research, which is why I was reading about aesthetics last night. It's basically what we have right now in music therapy and in creative arts therapies are a lot of theories that draw on different fields. Like my colleagues who work with neurorehabilitation are drawing from that science to inform what it is that they do. My colleagues that work in education, same thing. Even my own practice, I'm drawing on psychology and counseling theories to inform what I do. What we don't have are really robust theories that explain how we know what we know about our inner lives. So that's what I'll be studying.
So that's what you're going back to school for. In other words, to prove it scientifically? Like to get the actual research?
You know what? I don't know. Can I get back to you on that?
Okay. I'm sorry. I'm sorry. I guess I wasn't following.
No, it's okay. There's a couple of different things that I'll be doing. My advisor is Yoka Brett, and she is amazing. She's an amazing researcher. Right now, I think she has a study or an NIH grant for something to do with chronic pain and vocal methods of working with chronic pain. I could be misciting that. So in a month, I'll tell you if I was wrong or not. The focus of the program is interdisciplinary, so I'll be learning a lot about aesthetics, theory of aesthetics, but then I'll also be learning about neurobiology and sociocultural anthropology and all these different ways in which music can be understood.
Gotcha. Okay.
Having that as a base, I'll be better prepared to create interdisciplinary studies, like team science research.
Gotcha. So you're going back to school to improve on your skill set.
Yeah, I'm hoping to broaden how music therapists think and talk about how we're helpful. Because in my mind, we don't make any sense to exist as a profession if we can't talk about the context and the mechanism and the outcome that we're going for, and how the aesthetic experience, and the process of creating art helps that.
Right. And I think this is like not only for the cancer patients and people in the hospital setting, and even for the trauma patients and the psych wards that we're talking about, this could be beneficial for anybody.
Yeah.
Anybody suffering in any type of pain, any emotional pain, anything they want to work through. So is music therapy available? Because I mean, that's pretty much why I have the podcast, is to get this message out there, because not a lot of people, I didn't hear about music therapy till I met you.
Right.
When you were speaking at it at the foundation, and I thought I was blown away and I was fascinated by it.
Oh.
So I guess my question is, I know this could be beneficial for a lot of people. Can anybody just come off the street and be like, I want to see a musical therapist, rather than being in a lot of pain or being in the hospital?
No, I do know what you're saying. I think that recognition of the field, on the public awareness of the field, is pretty low in areas of the country where there aren't a lot of music therapists. The music therapists and art therapists separately have been working towards state recognition of the profession and state licensing under various boards. And in some states have been successful, and in other states are, still working on it.
Right.
Like in Maryland, there's a bill on the floor right now, I think, to recognize music therapy as a profession.
So you guys are relatively new then?
On that front, yes.
On the actual front of getting bills passed in state?
Yeah,
right.
State recognition.
Okay.
Yes.
Yeah.
Yes, relatively new. There's always so much to say about that, about professional issues and all that. You're probably no stranger to that, right? Like being a chiropractor, I mean, that's far more widely recognized.
Oh, no. So I do a specialty within the chiropractic field.
Right.
And it's called upper cervical chiropractic. And I didn't hear about it myself until someone tapped me on the shoulder and told me about it, and it saved my life. But I went 4 years in miserable, unbearable pain, and I didn't hear about it until 4 years later.
Wow.
And it's pretty much why I have the podcast, is to get the word out of all these amazing therapies that are going on, because the internet's literally leveling the playing field.
Yeah.
There's so much information and access to this information now that people haven't had even 10 years ago. And when you get people like yourself on here talking about what you do here, all it needs to land in is the right person's hands, like one person, and it could literally change someone's outlook on a perspective, or it could literally save their life and, get either treatment or whatever it is that person's looking for, they can find it. So
I think it's really cool that you're doing this podcast. I have to say, I was completely captivated by your podcast with Galena.
Oh, yeah. Galena's great. Yeah, she's amazing.
Yeah. I was like, whoa, I am learning so much right now. It's crazy.
Oh, absolutely. Yeah.
Yeah.
Just to talk to somebody that's from another side of the world.
Yeah.
And you get how they grew up, and it's fascinating, and you get to interview a lot of people, and you get to figure out that there's a common denominator in a lot of healers and a lot of people that are doing great things, and you get to learn a lot.
Absolutely. It's really cool that you're doing it.
So as far as music therapy goes, is there any good books or information or any renowned people that are doing the work that are in public figure, like any lectures on YouTube or books or anything that you think highly of?
Yes. Let me think. Depending on who the audience is, right? I might need to get back to you with a list of my favorites.
That's fine, yeah.
I will say, there's a lot of media out there that claims to represent music therapy that does not represent music therapy.
Right.
So, I mean, not to say that what is being done out there therapeutically with music isn't helpful, because certainly it can be. It can absolutely be.
But I understand what you're saying. You have to represent it the correct way.
Right. To call it music therapy, you'd need to represent it the right way. And so for that, I would point to news coverage of Gabby Giffords and her speech recovery using neurologic music therapy, doing neurologic music therapy as part of her speech rehab. That's a really powerful and accurate depiction of what music therapy can do on that front.
Are there any universities on the forefront of music therapy that have pretty good, solid programs?
There's a lot, actually.
Yeah.
Yeah.
Because I had a patient the other day that said she was going to school for music therapy.
Oh, really?
At Montclair State University, yes.
Oh, yeah, they've got a great program.
So they must have a program. It must be getting bigger and getting some recognition.
Yeah, so I think certain areas of the country have a wealth of programs, like New York, New Jersey, Philadelphia. Those areas have a ton of programs, and they're all very strong programs. There's a strong bent toward humanistic and psychodynamic thinking in that area of the country. And then if you go further south to Texas or Florida, you'll get a little bit more of a biomechanic and behavioral sort of approach to music therapy.
Gotcha, yeah.
And then if you go to Colorado, that's going to be your neurologic music therapy. These are just broad brushstrokes. Like there are other programs that also do all of those things and do them well, but those are in terms of name recognition.
I'm just curious, what are some of your goals and dreams in the near future? Ultimately, where would you like to take your music therapy career?
Well, if I could have anything I wanted, I would want to direct a creative arts therapy research program at a large medical institution. That's what I'd want to do.
Great.
Yeah.
Well, it seems like you're on the right path.
I hope so. I hope so.
Yeah.
Really, what I want to do is bring together a bunch of different types of practitioners. And do you mind, can I talk a little bit about my harmonica study?
Yes.
Yes.
Absolutely.
Okay. Okay.
Told you I'm going to be in it.
Right. Well, you don't have sickle cell disease, so you don't meet my inclusion criteria. Sorry, man. I mean, unless you do, and I'm assuming you don't have sickle cell disease.
No, I don't.
So, yeah, you're out.
What's the harmonica study?
So, I'll preface this by saying that I am not a wind player or a harmonica player at all.
Right.
At all. But you know how you can get sound into the harmonica by drawing breath and blowing through it?
Yeah.
So when kids are in the hospital who have sickle cell disease, they are prescribed the use of an incentive spirometer to help distend their lungs.
Wow.
To help prevent lung collapse.
Wow, I see where you're going
Yeah.
with this. That's amazing.
So you see where I'm going with this.
Yeah.
So, you know, there are those diatonic harmonicas that West Music sells for like $4 a pop.
Oh, yeah, they're cheap.
Yeah. Oh, yeah, they're super cheap. And they sound good.
Yeah.
You know?
Yeah.
And so if you are on like holes 4 and 5 and you draw in, you get the notes for a D minor chord, right?
Right. Yeah. They all coordinate.
Right. And do you know what's in D minor? Uptown Funk is in D minor.
Wow.
Yes.
I'm sure
yes.
all the kids
and
would love to play that, yeah.
I know, it's such a good song. It's still such a good song. Even though we've heard it a million times, I don't get tired of it.
Oh, never, yeah.
Yeah. So what I'm doing is pairing Uptown Funk with this harmonica with a little bit of deep breath, like education about why we would be doing this, why, you know, and how to do the deep breathing technique. Because when kids are in pain and they have pain like in their chest cavity or abdomen or anywhere, they tend to breathe in very shallowly. You know, it's like all up here. And so it's really working through, no, you have to get the air all the way down to the bottom of your lungs. And so I worked with a pulmonologist and a hematologist to develop the intervention so that it's clinically useful. And I am working with a nurse researcher and a bioengineer. Wow. Yeah, they developed a device to measure the airflow through the harmonica somehow. And because that's their part of this, I don't know exactly what it is that we're going to find out from that, but they do. They do, and they'll work with a pulmonologist to figure out how it's relevant.
Yeah, what's great about that, the whole study, is they're definitely going to be getting more oxygenated blood flow just from breathing.
Yeah.
Rather than just sitting in the hospital bed doing nothing.
Right.
So right there alone, that's a plus. And they get to play music,
From the music therapy side of it, I'm looking at engagement, right? Because people say they don't want to do the incentive spirometer because it's boring, or they forget about it, or, you know, they don't like it.
So you're hooking those two devices up?
Yes. Yeah.
That's genius. Right?
Well, kind of. We're making the incentive spirometer, like the function of it, electronic. The measurement function electronic. And then we're hooking the harmonica up to that device.
That is genius.
Isn't that crazy? Yeah.
So they're going to want to do it.
Yeah. So, I mean, that's my hope.
Yeah.
And then my hope is also to develop a library of songs that work with it, because eventually Uptown Funk's going to get old. And, you know. And there's also, like, Come Together. The Aerosmith version, not the Beatles recording, is a really good one for that. So, you know, just to cater to different tastes and to, you know, have different styles and all that kind of stuff. So I'm trying to hook in the patient's preference for the music so that it's something that, like, yeah, this is really cool, I want to be a part of it. And then they'll do that.
That sounds amazing. That's great. And they get to learn how to play the harmonica.
Well, they get to learn how to breathe in through the harmonica, because I don't know how to play the harmonica. But I can teach you how to breathe in deeply and stick a harmonica in your mouth while you're doing it. So
I think it's a win-win. So, Clarissa, are you still involved with the Never Retreat Foundation?
So I am not.
What's going on with that?
I need to actually call them because I just recently left Children's, but they filled a position. And so the funding for that Never Retreat has raised for the Children's National Music Therapy Program will still go to the Children's National Music Therapy Program. And the person who's in there is actually somebody I trained. So she was my first intern. Yeah, I'm really proud of her. She's really great. And she's got a different skill set and like different energy, and she's much more outgoing and all this kind of stuff.
You're outgoing. What are you talking about?
Well, thank you. No, I'm one of those extroverted introvert, you know, like one of those.
If you say so.
Well, I mean, she's the kind of person who would love to organize a talent show. My worst nightmare. I don't want to do that. So, but that's the kind of thing that kids would love to do. So
gotcha.
I'm happy about that.
Well, Clarissa, thank you so much for coming on. I learned a lot, and I think it's absolutely amazing what you and everybody in your field gets to do. And I think you guys are on to something great, and it's only going to go up from here.
Well, thank you so much for having me. It's been a real pleasure to be a guest on this podcast.
Absolutely. I would love to have you back on, maybe when you finish your program, and I would love to find out more of how that harmonica study goes.
I will definitely keep you posted. All right.
All right.
Thank you,
much,
Kevin.
Clarissa.
Have a good one.
All right. Thank you, everyone, for listening. My private practice is located in New Jersey at Montclair Upper Cervical Chiropractic. If you have any additional questions about today's podcast, other episodes, or any questions about Blair Upper Cervical Chiropractic in general, feel free to visit my website at drkevinpecca.com or subscribe to my YouTube channel at Dr. Kevin Pecca. Hope you enjoyed the show. Cheers.